I will take a short introductory class on electrocardiography. Electrocardiography. What is this procedure? This is a procedure. Electrocardiography is a procedure. Procedure of what? Recording electrical activity of the heart. Electrical activity of the heart. But while recording this activity, we will be not recording directly the electrical activity of the heart, directly from the heart, but from the body surface. So question is how this electricity that is generated in heart is coming to the surface of our heart. So if it is known to you, then you will be knowing, yes, the cardiac activity that is generated in the heart, it can be recorded from the surface, body surface also. So let us first define what is electrocardiography. Electrocardiography is the procedure or is the technique by which we record the electrical activities of the heart. The heart produces current in the SA node, and we know this current means cardiac impulse passes from the SA node to the AV node. First it spreads in the atrium, then it comes to the AV node. Then from the AV node, here some delay is made. From here, it enters into the septum, intraventricular septum. That too, mainly to the whose part of the septum? To the left. This is the wall of the septum. To the left side of the septum. Okay. And from the left side, the current flows from the left side to the right side of the septum. Okay. In this way, it travels. In this way, it travels towards the apex. Okay, from SA node, it is coming through aorta, through atria, coming to the AV node. Here is the AV node. From AV node, the current enters into the impulse enters into the septum, and mainly this is the right surface of the septum. This is the left surface. This is the right surface. So first it will enter here and gradually come towards the apex. And while coming down, it will send impulse to the surface. And this is the what? Right ventricle. So this is the septum. So from here it is impulse is coming to this side. And ultimately it will reach to the apex. Then this will travel through Purkinje system towards the base of the ventricles. So how this is spreading? From SA node, it is coming to the AV node. From AV node through the septum, then to the apex. From the apex, it spreads towards the base. Within the ventricle, whose part first gets the impulse? Whose part? Huh? I told you what. From AV node, it enters into the septum. So septum is the first part of the ventricle that will get the impulse of synodal impulse, cardiac impulse. Then to the apex, then throughout the ventricular wall, and lastly to the base of the heart. Okay? While spreading this impulse, what happens to the surface of the heart? While traveling, suppose when it enters into the septum, the surface of the septum becomes negatively charged, depolarized. Means depolarized, it was previously positively charged surface. Now because of this current, means while it travels, no, so it produces depolarization waves. Depolarized waves means action potentials are produced. So these action potentials are actually traveling These are the cardiac impulse. They are traveling. So while traveling, what happens? Surface becomes negatively charged. Okay, now we see one thing. This part is becoming negatively charged because of the depolarization, because of the cardiac action potential. Now see, some part is negatively charged, some part is positively charged. Now what happens? There will be flow of current. There will be flow of current like this. There will be electrical field, and this electrical field will be transmitted throughout the body. Okay? How it can transmit it? Very simple. Because we can consider our body as a volume conductor, and the heart is lying within this volume conductor. What is volume conductor? It's a volume where there are electrolytes, and because of the presence of these electrolytes, current can pass easily. So our body is having fluids, and these fluids are having electrolytes. So it's very easy to pass. It's a good conductor. It is a good conductor. Our body is a bit inside or outside, in the surface. They are good conductor because of what? The fluid, and the fluid having electrolytes. So now this current produced in the heart, they can transmit it throughout the body. Okay? So some part of my body may become positively charged at an instant. Positively charged, some part may remain still negative because of this. This part is negative charge, this part. Gradually, while repolarization will occur, this part is depolarized. Okay, this is still polarized. So gradually one time this will also become negative. Okay, not that it always remain like that. Because depolarization will be passing through this. When this repolarization coming to the ventricle, that part will become positive. Okay, so every time what will happen, if you connect this with a galvanometer, this is a galvanometer, this from here it is having, it is acting as a dipole. It is acting as a dipole. One side is positive, another side is negative. Our body also. Now it is, this side is negative, this side is positive. Moments after, maybe reverse. So every time it is changing. Bit to bit it is changing. So the deflection I will be getting here, it is not a permanent way. It will show this type of deflections. Sometimes it is positive, sometimes it is negative during this phase of cardiac cycle. Okay, because of what? Because of traveling of these cardiac impulses, traveling of depolarization wave, and this will be followed by repolarization. So depolarization, repolarization, they will create potential changes in the body, and these changes can be recorded by a galvanometer. Okay, ECG machine is nothing but a galvanometer. It is nothing but it is one of the, this is another flat type, different type physically. It looks like this radio, and the other is flat. You will see it is, we are having also. So this is the electrocardiograph. So here what happens, this potential difference that we observed here, this is actually amplified. So amplified potential difference will be it will be recorded during electrocardiography. So what is electrocardiography? Graphy we understood? Recording of electrical activity of the heart from the surface of our body. During operation, surgery, open heart surgery, that time direct placement of electrode can also be made. So here we will be not be conventionally, it is not done. It is done from the surface of the body. Okay. So now now what? Another two terms you are not to confuse. One term is electrocardiogram, and another term is electrocardiograph. Now, I know you are confused. If I ask, what is electrocardiograph?
This is the graph produced after taking the values. And the gram is the machine.
Electrocardiograph is a machine and electrocardiogram is the graph we see.
But she said just opposite.
So
Isn't it?
she is correct.
Now, who is correct? So then what is electrocardiograph? It's a machine. Graph is the machine. Okay. And through electrocardiography from the machine, we will get a recorded graph. Okay. And this is called, we will obtain the electrical recording. We will obtain this recording graphically presented. And this is called electrocardiogram. Again, I will ask in our next class, what do you mean by electrocardiograph and what do you mean by electrocardiogram? Now, next part is of our lecture, how can we record this? One is galvanometer needed, this is the machine, and you can see there are a lot of wires which are to be placed in our body surface. So these are electrodes only. These wires are electrodes. With this, these electrodes will be used for some lead system. Okay, actually we will be recording this electrical activity using some lead system. Lead system, L-E-A-D, lead system. Now what are these leads? These every leads, there are various leads, various kinds of leads. Each kind is also having different types. Okay, let us first discuss what is leads. Leads is comprised of two electrodes. Among these two electrodes, one will be positive electrode and another would be negative electrode. This positive electrode will be connected to the galvanometer in the positive terminal, and the negative electrode will be placed on the negative terminal of the electrode of this galvanometer. Okay, in the galvanometer. Okay. Now let's see what are the different lead system. Lead system are two types of lead system we usually use. One is unipolar, another is bipolar. One is unipolar, another is bipolar. So first, let us understand what is bipolar. This is simple, bipolar. Means one negative, another positive will be there. So in the bipolar system, we use three limbs. Right hand, left hand, right hand, left leg and left leg. The positive, so lead one. These are bipolar. Bipolar is having three leads. Okay, lead one, lead two, lead three. Lead one, lead two, lead three. What are these? Bipolar or unipolar? Correct, bipolar. So bipolar leads, these bipolar leads will have one negative electrode, will have one positive. This is lead one. What is this? Lead one. It will connect, the electrode will connect my left hand and right hand. Now where to place the positive electrode? Either in this hand or in this hand. It is in the left hand. Where? Here, so it is positive electrode, and in the right hand, so it is the connection between right hand and left hand mentioned, right and left hand arm, and the positive electrode will be placed on left arm, and the negative electrode will be placed on right arm. So this is one system, very easy. And see, connecting this, it is facing my heart. How? From top. Is facing my heart from top. Okay. Be alert. Then lead 2. Lead 2. How will connect? Right arm, left leg. Right arm, left leg. And where will be the positive electrode? Left, mention it, write it. Positive electrode at the left foot and negative electrode on the right hand. So see, in lead 1, negative electrode was in the right hand, and in lead 2 also, negative electrode on the right hand. Okay, now see how we will connect lead 3. We will connect lead 3 by connecting left leg and left arm. Left leg and right arm. Where I will place the right electrode, positive electrode? Left leg. And negative electrode? Left arm. You see, left arm. So this is lead 1, lead 2, and lead 3. Is that clear to you? Okay, now tell me. In lead 1, where I will place the positive electrode? There will be 2 electrodes, positive and negative. Where I will place the positive electrode? In my right hand or in my left hand?
Right hand.
Is it correct? That's why I am telling you are sleeping. Okay? You are sleeping. Where it is positive? Left hand. Negative here. Okay? And lead to connection? Right arm, left foot. Again here negative, positive. This means this is positive, negative, negative, positive, positive. Very easy to remember. Here, one positive, one negative. Positive is when? Only when I will be recording lead 1. Okay, lead 2, it will be negative, it will be positive. In lead 3, we will be connecting left leg, left arm. Very simple. Okay? So this is bipolar lead. This is bipolar lead. We also call it standard lead. Standard limb lead. Bipolar lead also called standard limb leads. Fine. So let us now discuss about what are unipolar leads. Before I study the unipolar leads, let us assume one thing. Let us assume a equilateral triangle. This arm, its root is this. Acromion. And for this arm, root is this. And for my leg, the root is this. So now I can assume a triangle, equilateral triangle. This is one side, this is another side, and this is another side. And heart is at the center. Where is the heart? Here is the center. Okay. Now, if I get this equilateral triangle, and at the center is what? Heart. At the center is heart. Now, Einthoven, who is the Einthoven? The father of electrocardiography. William is a Dutch scientist. William Einthoven. Willem, W-I-L-L-E-M. William Einthoven. E-I-N-T-H-O-V-E-N. William Einthoven, this triangle is regarded as Einthoven triangle. So what is Einthoven triangle? You understood? Is that clear to you, right? Clear? Now, Mr. Einthoven, he said, if I connect, if I connect all for this negative pole, negative electrode, for this the negative electrode, and for this the negative electrode connect together and place a resistance on it, okay, then what will be there? Only positive electrodes will remain. Okay, now these positive electrodes are called active electrodes or active or exploring electrode. Active electrode or exploring electrode. Now this active electrode which is positive, now I can place it on my left palm. Other three electrodes are joined together, negative electrodes joined together. Okay, and the result is 0. When they are connected together, this result is the Anthon's law. Result is 0. Okay, so now the other electrode, when I place, so what is the voltage of right hand in reference to 0 voltage? What is the difference? And when I place the exploring electrode here, then it is right hand, it is AVR, augmented AVR, augmented unipolar leads, limb leads. So right hand AVR, and if I place the positive electrode here in my leg, then it will be AVL, and if I place the positive electrode here, then it will be AVF. So these leads, maybe these limb leads, unipolar limb leads are called AVL, AVL, AVF. Again I am telling, for limb leads, the negative pole are connected together with a resistance. Okay, as a result, there will be getting 0 voltage. Okay, now the positive electrode, if I place here in my left hand, then the voltage will be compared in respect to 0. So this way the lead we obtained, we will call it is the left hand AVL. And when I will place the positive electrode here, what I will get? AVR. And where I place the positive electrode here, what I will get? AVF. So these are the augmented leads. Is that clear? Right? Any doubt? Okay. Now another lead system is there. These are called precordial leads. These are also unipolar limb leads. Precordial, also called chest leads. These are also called, so these chest leads are nothing but unipolar leads. So in the unipolar leads, chest leads, here also, all the negative poles are together, and they are called the reference electrode, and there is one exploring electrode. Means this positive electrode will explore my heart from different positions. From anterior to lateral to apical. So in different region, it will screen, it will survey my heart from different sides. So that's why these are the referring electrodes. Okay. Why this? We are also having one exploring electrode. Now regarding the story. So ultimately the shipment came to Sri Lanka, and the people were eagerly waiting to see the animal. Okay. So whenever it was put on the shore, immediately lot of people came to see this. Some people got the opportunity to see the elephant from the front hole, and some people got the opportunity to see from the side, and somebody from. Okay, there is so many. So only one opportunity was the seeing, not that from this side, all the sides. So they went back to their home, and those who couldn't come, they asked them, how the elephant looked like. And this was described in 3 different ways. You see, you can imagine those who saw the elephant from the front, what he will describe, isn't it? Yeah. It is elephant, it is having white color, 2 things coming out, and one is like this, and having, these are the explanation, these are the description. And who saw from the side, what kids saw? Only some flat area, the gray area, that's all. And from back, okay, everybody is correct, but not full. Full description not obtained. So, for full description, you have to see the heart from all sides. From all sides. Otherwise, if you can get a fault at the anterior surface of the ventricle, but you may miss what is there in the, whether any fault is there in the septum, or in the posterior wall, or in the inferior wall. So for that purpose, you need what? To look into it from various sides. That's why this chest electrode or this exploring electrode or precordial leads came into. Okay. Now it is having how many leads? 6 leads. There are other leads, but in the conventional system, it is only 6 precordial leads, chest leads are used. Now, we said there will be 1 positive electrodes. So, we term this leads system as V1, precordial lead, V1, V2, V3, V4, V5 and V6. Now, where to put the positive electrode in case of V1? It is on right sternal border at 4th intercostal space. You know 4th intercostal space? Right sternal border. Just the space originating from a particular area of the border. So that is the place. Right sternal border of 4th intercostal space. You have to place the electrode there. Then you will get, if you take the recording, you will get V1. Hello? What would be V2? You didn't tell sir yet. How can I say? So remember, V2 just opposite of V1. What is the opposite? Left sternal border in the same space. 4th intercostal space. And the 4th, sir, where is 3rd? Directly you are coming to 4th? I will not tell. 3rd is for you. The 4th is 5th intercostal space. So 5th intercostal space starts from here and it will go to the back up to the vertebral column. Where to keep? Mid clavicular line. So draw a mid clavicular line, vertical line, and it will cross the 5th intercostal space. This crossing point is the location of V4. Location of V4. Is that correct? Is that correct? Okay. Right? So this is the position of V4. Who will tell what is the position of V4? This is the location of the. So should I tell about the location of the lead 3? I also forgot. Let us do some adjustment for this. We know where the P4 is and where the V2 is. So let us do one thing. Draw a line from B2 to B4. So in between the center of this line, B2 and B4, draw the line. The center of this line is the location of the B3. Is it clear? Right? So it's simple. So once you identify the V4 position and V2 position. Now it is very simple to you to look at the V3 position. So this will be in between V2 and V3, just in between. In the draw a line, hypothetical line, not you will be drawing line with a pen or something else. So it is a hypothetical line, so at the center you will do. So I got V1, V2, V3 and V4. Now what would be the location of V5 and V6? In some book, two type of presentation is there. Some book says the V4 and V5 should be at the level of the V4. This is the level of the V4. And some book says no, it is the same fifth intercostal space. Same intercostal space, but intercostal space it is okay. So it starts from here, it will go into the back. So where to keep? So this is our axilla. So this axilla is having, can I assume one line? This is the anterior side, this is the posterior side, and this is the middle. So anterior axillary line downward. Anterior axilla. So assume a line vertically, and it will be crossing fifth intercostal space. This is the location of B5. Okay. Actually, this fifth intercostal, this is bending, no? Space is bending. So it will be a little bit higher in reference to that at the level. But when you will be obtaining the record, not so much variation you will find. So much variation you will not get. So it is the same. That is also possible. Same level of B4, horizontal level, and or this fifth intercostal space, anterior axillary line. And another, this is B5, and B5 again you imagine another line from mid axilla. So this is the mid axilla. From here you assume another line. It will be crossing the fifth intercostal space or the level of B4. So that line will be the location for placing the electrode of V6. Is that clear? So we have altogether how many leads? Total including bipolar, augmented and chest lead. Augmented we've got 3, AVR, AVL, AVF, and bipolar we got lead 1, lead 2, lead 3. So 3 plus 3, and here we got 6. How many total? 12 leads. So whenever you will be asking for an ECG for a patient, you will be asking for actually 12 lead electrocardiogram. So there will be 12 leads. What are these? Lead 1, lead 2, lead 3, AVR, AVL, AVF, V1, V2, V3, V4, V5, V6. So with this recording, you will find, in this recording, you will find what? Some complexes. What complexes? Some wave complexes. And these wave complexes are called PQRST complexes. Because these waves, there will be, and this shape of these waves will be changed according to the lead system. Okay, so these complexes, PQRST complexes, what are these waves? We will now discuss about these complexes. Before that, we want to show you something. Unless without this, it will be very difficult, because these waves, we will be analyzing these waves, PQRST waves. What we will be analyzing? Some waves will be positive waves. What are positive waves? Positive waves, there will be one baseline, the zero line. Zero line, neither positive nor negative. So this is the isoelectric line. So it is called baseline. So if some wave is above the baseline, so that will be called positive. That will be positive wave, and some wave will be below the baseline. They are negative wave. Okay. In PQRS2 we will find some waves. Sometimes they are positive, sometimes they are negative. Okay. So sometimes it is flat, neither positive nor negative. We'll see what happens and why it happens. If you know that, then you became the expert in electrocardiography. Okay, so you have to know this. What for analyze? The amplitude of the waves, either positive or negative. It may be plus amplitude plus this mass or minus this mass. If it is below the baseline, then it is minus this. So amplitude. What is the height? Height is the amplitude. So and it is expressed in millivolt. How will you express? Not in centimeter or millimeter will you express. We'll get it in millimeter. However, we'll convert it into amplitude. We will express into millivolt. Voltage difference. So it should be in millivolt. The voltage difference. The voltage is very less, no? So it is in millivolt. And this is one thing. We have to measure the amplitude of different waves. Then we have to measure the time. And 3 different time you will get. One is duration. One is segment. Another is duration, segment. Another is interval. Sir, what is the difference between duration? It appears all are same. It appears all are same. Duration means time. Segment, it is also related to time. And interval, it is also time. Yes, there is difference. P wave, one of the wave of ECG complex. So there should be a duration of this wave, starting and ending. So these are the duration. QRS complex, QRS. So there should be a starting point and ending point. So this is the duration. T wave, it is also having a duration, starting of T wave, ending of. So this is duration. Is that clear? And segment. What is segment? Segment is ending of a wave and starting of another wave. So in between there is a segment, ending of a wave and starting of another wave. So in between there is a time, and this time there is no wave in between. So this is called segment, like ST segment. Very important. If you are expert in studying ST segment, you can easily identify ischemic heart disease, ischemia, pain. So whether there is any ischemia, go for a ECG, electrocardiogram, and you see the ST segment. Whether it is elevated or it is depressed. So always in case of acute myocardial ischemia, there will be always depression in ST segment. Depression in ST segment. There may be elevation from baseline. In respect, this depression means in respect of the baseline, the ST segment is below the baseline. That is, it is depressed. ST segment is depressed. It may go up above the baseline. It is called ST segment elevation. So there are different pathologies. We will express in the next day. What are the causes, but what are the conditions we can see, we will get the ST elevation. You have heard the name of myocardial infarction. It happens in myocardial infarction. It happens in left bundle branch block. Left bundle branch block. What is left bundle branch? Bundle of his. It is divided into right bundle into left bundle. Okay. If this left bundle is blocked, unable to transmit impulses, it is called, and in that this will cause changes in complex, changes in ST segment. So with that also you can diagnose. This is not only the single criteria, there are other criteria too. This is one of the criteria. With this criteria, you can identify whether there is left bundle branch block, or there is right bundle branch block, or there is hemi block, or there is AV block, AV dissociation. So this is different kind of conduction defect you can. One thing I forgot to tell you, what is the use, what is the importance, why we will be studying, what is the usefulness, what is the utility of ECG. With ECG, what we can know, what we can derive, what we can understand. One thing we can determine the heart rate and whether these are rhythmic or there is, there is no rhythm. So arrhythmia, you can diagnose arrhythmia also. It may be, you can diagnose, we know, during inspiration in healthy person, during inspiration heart rate increases, during expiration heart rate decreases. This is called respiratory sinus arrhythmia. So we can diagnose this with this. And not only this, if the myocardium is getting enough blood, enough oxygen, means ischemia. When sufficient oxygen will not be given to the supplied to the myocardium, then ECG will show some change. With that you can diagnose myocardial ischemia. If some portion of the heart is not getting blood supply at all, means infarction. If there is infarction because of blockage of what? Blockage of what? Coronary artery. Any coronary artery, that will cause no supply of oxygen or blood to that area, particular area. So that area will be necrosed, going to be necrosed. So this condition is called infarction. So you can identify infarction. You can also identify enlargement of the heart, hypertrophy of the heart. But you cannot diagnose any valvular disease. You can't diagnose any valvular disease with this. Can it be diagnosed? Which valve is affected? How can you diagnose? That will be indirect, not direct. Indirect or direct? Indirectly. So because of this, some enlargement will be there. So for enlargement, their cause may be different. So whether it is because of enlargement, you can see in the ECG, but whether for this enlargement, there are various reasons. Whether it is because of valve defect, then you have to use your stethoscope or use echocardiography to make it confirm. Okay, so directly it cannot identify, they cannot say directly it is having this and this. This valvular mitral stenosis or aortic stenosis, though that cannot be said. Okay, and effect of changes in ions, particularly which ion? Potassium ion. Hypokalemia, hyperkalemia, it changes the ECG pattern. So whether there is hypokalemia or hyperkalemia, that also can be diagnosed using electrocardiography. You can determine the cardiac axis of the heart. So your heart may be, it may be arranged like this vertically. It may be this way. So it may axis, this sort of axis can be changed. So you can determine what is the axis of the heart, electrical axis of the heart, QRS axis. So we will be calculating, you have to measure the electrical axis of the, if it is, axis is shifted to the left, it can be shifted to the right and it can be shifted to the right. What are the clinical condition where in which this is axis is shifted to the right? You have to know that. So if you find this shift, so say particularly it happens particularly in hypertrophy. Okay, right ventricular hypertrophy, there will be one kind of shift. Left ventricular hypertrophy, there could be another kind of shift. So these are the usefulness of electrocardiography.